our special show, Living Long and Healthy with COVID Vaccination. I'm Gargi Rawat. Now, this show seeks to address any concerns that you may have regarding the vaccination and living in this new normal, because do remember, the risk of COVID infections continues even as restrictions have been lifted in most parts of the country. Cases are rising and vaccination is the only way that you can protect yourself. Well, today we have with us experts who will address all your concerns and questions. Joining us on the show today, we have Dr. Vinayak Harale, consulting diabetologist and endocrinologist, Supreme Clinic, Pune, and Dr. Anil Kumar, lead senior consultant, Aster Cardiac Sciences, Aster Medcity, Kochi, Kerala. Thank you so much, doctors, for taking time out to answer all the queries that we have. Dr. Harale, I'd like to start with you. How does the vaccination work in providing effective protection against the COVID virus? This is something people ask us a lot.
Yes, this is a very basic question and all of us are curious how this vaccine actually works. So to answer this question, we should know what is antigen antibodies. So in short, whatever infection we are getting, whether it is because of some bacteria, viral or fungus, they represent something called as antigen. They enter in our body system, then it develops something called as antibody, which are produced by the immune system. So same thing happened with this vaccination. So vaccine is nothing but some inactivated form of virus. So when this was injected in our body, then our immunity system produces something called as a memory T cell or immunity system. It increases the antibody, and so that whenever we get infection in future with the same virus, then there will be less severity, or our immunity system will fight against that antigen, so that we will not have infection, or even if we have, we will have very less severity type of infection.
Dr. Kumar, the next question to you, and this is something that I'd like to ask as somebody who actually had coronavirus in November. Does the immunity from COVID vaccines last longer than immunity post the COVID infection? Do tell me.
As was pointed out, the body develops an immunity to the COVID virus. Now, how long does that last? That is something which is being studied very actively. And comparing it to the COVID vaccine antibody, which both infection and the vaccine is supposed to develop antibody, as well as what is called as cell-mediated immunity. Now, we have studies which show that the antibody-mediated immunity will last up to 6 months. Now, after that, whether the cell-mediated immunity will last longer, we will have to wait. The jury is still out on that. We would really have to wait for further studies to see how long it will last. So let me tell you, the COVID illness will give you some immunity, but as of now, the government and the health authorities recommend that even after COVID infection, after a month, you should take the COVID vaccination. So we are still learning and the process is still on. I'm sure we'll learn as the months go by. We will know whether it will last for a year. I presume finally it will be like the influenza vaccine. The vaccine we may have to take once a year. The disease may give some immunity, and that also we are not sure whether it is long lasting. That is why even after an illness, you may have to take the vaccine. Have you taken the vaccine?
No, doctor, not yet. I'm not yet eligible for the vaccine, so waiting for my when I do become eligible. But Dr. Harale, now many people have had the first dose. Those who are eligible, they're waiting for the second dose. So how long before the vaccine actually provides you protection against the disease?
So WHO has stated that at least it starts working after 12 days after taking the vaccination, but the full protection we get after the second dose of the vaccination, which is 4 to 8 weeks apart.
All right. And Dr. Kumar, what are the common side effects that are being observed post-vaccination? We know that people have to sit for half an hour, at the clinic, at the hospital. Are there any side effects, especially for those who are suffering from diabetes or heart disease, that they need to watch out for?
The common side effects that we are all facing is only some body pains, some pain at the injection site, and occasionally allergic reactions. So the common side effects are nothing to be worried about. If you're worried that the vaccine will cause you major illness, you don't need to worry about it. It's a very rare phenomenon. And the most will have some body pains, some tiredness. In fact, after the second dose, I was tired for a few days, but nothing more beyond that. The major side effects that have been reported have all been in a few per million, and that is something which we are still studying on, but it should not bother the major population. Among heart disease patients and stroke patients or even diabetics, these are the patients who need the vaccine the most. We are not worried about major complication in them. Even those reported in Europe, we know that it's not more than what happens in the natural instance in the community, but after vaccination, this is being highlighted. So I would say none of us should worry about the side effects of the vaccine. Find a reason to take the vaccine. Don't find reasons not to take the vaccine.
All right. And yes, the people with diabetes are the ones who need to take the vaccine as you know, they're suffering worse infections when they do get coronavirus. Dr. Harale, are there any special instructions for people with type 1 diabetes and complications, and especially with the elderly who have a long, standing history of diabetes? Is there anything that they need to tweak with their medication before they go in for the vaccine?
Okay, so first, what is the type 1 diabetes? So for a general population, type 1 diabetes is a diabetes which happens in the young age, preferably mostly below 15 years of age, and it is an insulin dependent diabetes. So they are eligible for the vaccination. There is no contraindication except their age should be above 16 years of age. So all vaccines have been studied, and they are studied above the age of 16 years of age. They found they are safe. So all type 1 diabetes patients, they can take vaccine only if their age is above 16 years of age. And second, the long-standing type 2 diabetes, even with various complications like microvascular complication, so they are also eligible for the vaccination. So there is no contraindication. Even their sugars are uncontrolled, they can still take the vaccination. With the complications, only certain medications, like if the patient is taking some anticoagulant medications, in certain population only there are some restrictions. But in general, all the type 2 diabetic patients with complications, they can take vaccination.
All right, and Dr. Kumar, same for people with heart disease, hypertension medication. Does that need to be tweaked or changed on the day that they're going in for the vaccine? And any specific instructions for people who've had a history of lung disease and asthma?
So for heart disease patients, I insist that they do not stop any of their medications. Earlier there was a scare that maybe this should not be taken in patients with blood thinners. But remember, everybody with blood thinners are not in this subset. It's only those who are on anticoagulants or metallic valves, their should be checked, and their INR should not be more than 3. But anybody on aspirin or similar blood thinners for angioplasty and all, they should not stop their medications. Again, blood pressure medication should not be stopped before the angioplasty. So the common message is, do not stop any of your medications unless you are on blood thinners like anticoagulation medications. So not the common aspirin, clopidogrel or other medicines which are used for angioplasty. You should never stop these medications, especially with the risk of this thrombosis being mentioned. I have a feeling that people have stopped their medicines and gone for the vaccine. So all heart disease patients should continue the medicines and go for vaccination. For asthma and other patients, there is no contraindication for these vaccines. They also are more prone for the COVID infection, and they can have more lung damage. So they should take the vaccine the earliest.
All right, Dr. Harale, if we talk about, the vaccine dosage, and recently the gap between 2 doses of Covishield, which is the AstraZeneca vaccine here, that has been increased in India. If you could explain to viewers why this step was taken.
Okay, so initial label indication was the second dose of vaccine was supposed to be given 4 weeks after the first dose, but later on various studies, they have found that the efficacy of vaccination is increased from 70 to 82% if the second dose is taken for 6 to 8 weeks later. So that's why they have recently changed the label indication that the second dose we need to take at least 6 to 8 weeks later after taking the first dose.
Right, and this is only for Covishield, not for Covaxin yet. Dr. Kumar, should people with mental illness like epilepsy, etc., take the vaccine? Any special instructions for them?
Never. We don't have any precautions for such patients. These relate to earlier vaccines which were for DPT or pertussis and all. For epilepsy and all this, the COVID vaccine is not contraindicated. All patients with comorbidities should be taking the vaccine at the earliest.
All right. Thank you so much for clearing those doubts. Now, time for us to slip into a short break, but we'll return and answer all your questions that you may have, any concerns that you may have about the vaccination. Stay with us. Welcome back. You're watching our special show, Living Long and Healthy with COVID Vaccinations, and we're answering all your queries. In fact, we have doctors taking those queries. And Dr. Vinayak Harale, I'd like to ask you, what precautions should people with liver disease take before the vaccination, and is the entire procedure safe for them?
Yes, for those who are having some liver disease like cirrhosis, and if there is INR is deranged, so INR is some marker related to some bleeding disorder. So if it is above 3, then the vaccine should be avoided. Otherwise, all liver patients, they are safe to take this vaccine.
All right, Dr. Kumar, now over the last year, when we were under lockdown and the pandemic first hit the country, hit the world, in fact, many people have put off procedures that they were meant to be taking, especially people who had heart disease. What is your advice to them now? Now cases are rising again, should they go ahead and get their procedures done?
Problem for us, people with significant heart disease were staying at home and scared of going to the hospital. Now let me tell you, most hospitals have now beautiful protocols set in place to ensure that the patients do not get the risk of COVID by coming into the hospital. But having said that, if it is an elective procedure, it's better to take the vaccine and then go for the procedure. You can complete the vaccine, give it 2 weeks, and then plan for the elective procedure. If you're having recurrent chest pain or if you have a breathing difficulty, it's better not to delay and go to the hospital at the earliest. That way, the patients who are coming in now are much more serious, and what we are seeing are much more sicker patients as compared to what we saw before the COVID era. So the message is, if you have a problem, ongoing discomforts, go to the hospital at the earliest. If it's an planned procedure just for a checkup, delay it after your vaccination is over.
All right, so wait and get vaccinated, preferably there. Dr. Harale, should a person who has diabetes actually choose between the 2 vaccines? We have only 2 vaccines available in the country, Covishield and Covaxin. Are both safe? Is there any special advice on that front?
No, they can take whichever vaccine is available nearby them. There is nothing like one vaccine is better than other. Covishield or Covaxin, both are equally efficacious, and whatever the available option nearest to you, so they can take the vaccine. And not only for diabetic patients, for all the comorbidities and all the adults, those who are eligible for vaccination, they must take vaccination, whichever vaccine is available nearby to them, because the efficacy is almost the same is found in both these vaccines.
All right, and Dr. Kumar, is the vaccination safe for people who have suffered from a stroke?
Actually, if you have suffered from an acute event, be it a stroke or a heart attack, it is better to defer for 1 month. The concept is that the body immunity should be good and the body should react well to the vaccine. So if you have an acute event, if it is a stroke or a heart attack, better to wait till you are stable and take the vaccination after a month. The most medically sensible advice that I can give. So after a stroke, wait for 1 month.
All right, so that is what people need to watch out for. And Dr. Harale, is the vaccination safe for people who have thyroid conditions?
Yes, it is absolutely safe in both hypothyroid as well as hyperthyroidism condition, and even whatever the medication they are taking for the thyroid disorder, they no need to discontinue any medication, and these are all safe populations. They can take the vaccination.
All right, and Dr. Kumar, similarly for people who have heart disease, who may have undergone a heart surgery, stenting, valve replacement procedures, is it safe for them to go ahead and get vaccinated?
Yeah, definitely. Those patients who have undergone bypass, those who have angioplasty, all these patients should get priority in undergoing the vaccination. But the patients who have metallic virus, I just alluded to earlier, they should have their eye blood test as was previously mentioned. And if INR is more than 3, it's better to reduce the dose of medication to INR less than 3 and then go ahead with the vaccination. Let me tell that you always find reasons to take the vaccine rather than not to take the vaccine. And the most high-risk patients are the patients with heart disease, with diabetes, with hypertension. So these patients all should take vaccine. Only those patients who have had valve replacements, check your INR blood test, and if it is more than 3, defer it till it comes to less than 3. You should always consult your doctor with the INR report. But again, find reasons to take the vaccine rather than not to take it.
Right, Dr. Harale, now talking, about the issue of diabetes, there's also been cases of people who actually got coronavirus and developed diabetes. This is something that is being studied. If you could tell us about this, is something like this being seen here in India as well?
Yes. There are a few cases that have been reported even after coronavirus infection. We have seen the new onset of diabetes. So there are 2 things which are pathologies which are responsible for developing this. First of all, the infection itself. There are some studies which have shown that the infection can cause, it affects the pancreas and because of which there is a development of the diabetes. And second thing is many severely ill COVID patients, they do require medications like steroids, and because of the drug induced also, even previously they are pre-diabetic and they became a diabetic after this medications like steroids. So the viral infection itself, and because of certain medications. So these are the two reasons because of which now patients might develop the diabetes after this infection.
So all the more reason, to go ahead and get vaccinated and avoid any treatment or even getting the virus. Dr. Kumar, you were talking about the recent controversy in Europe over the clotting fears following the AstraZeneca vaccine. Now, it led to a lot of vaccine hesitancy. Once again, you had European countries stopping the AstraZeneca vaccine, then allowing it again. Do you think the entire controversy has been put to rest? India, the authorities here have said that no such issues have been observed here.
It was very worth data that came out initially. When vaccine surge was going on, you really found this alarming data coming in. But if you see, the European authorities have gone into it, and it has noted that it is 30 out of 5 million, which is a 0.00006% of patients who developed it. And they compared it with the data in the normal community and found that this is not a strong signal. It is not showing anything beyond what would normally happen in the community. And that's how now they've got back to the vaccination schedule. And in India, also the authorities have gone through around 5,000 adverse events and found out that the number of events that happened, like strokes and heart attacks, did happen after the vaccination, but that was not related to the vaccine. These were already patients who were having heart disease and having neurological disease. This data has come in very recently, and we know that it is not vaccine related. So it's not a vaccine causing the stroke, but when you give to patients who are above 60 who already have heart disease, the normal incidence of the normal happenings of attacks and strokes will tend to be highlighted as vaccine related. So let me reassure you, as medical professionals, we are sure that the vaccines are not causing these strokes or heart attacks, and the data out there is very reassuring. I will advise for everyone, go ahead with their vaccination and not to give serious concern about these side effects.
All right, important point there, and hopefully that entire controversy is laid to rest now, and people can just go ahead and get the vaccine because it's more important to get protected. Dr. Harale, finally, what about people who are prone to allergies, who may be allergic to certain medication? Is there something that they need to discuss with their doctors? Any special, steps that they need to take regarding any allergies that they may have before they get vaccinated?
As such, there is no medications which are related to the vaccination. If they have some history of allergy because of some other vaccination, so in that case, they can consult to their doctor and take some anti-allergic medications. But the prior history of allergy to some vaccine is the only one thing we have to take caution. Otherwise, everyone can take the vaccination.
All right, so go ahead and get vaccinated because, as we said, that's the only way you can protect yourself from this disease and your service to society at large to eradicate coronavirus. Thank you so much, doctors, for taking our time and answering all the questions for us. Well, that's all the time we have on the show today. Thanks so much for watching. Goodbye.